So, orphan drugs, what's the link to what we've been talking about? Well, for me, it's fundamentally a route to market. So, an orphan drug is a drug that gets a designation for use in a small number of patients. So, in the EU, if you get an incidence of 5 in 10,000, sorry, 50 in 10,000, that qualifies for an orphan drug status. What it actually does is make the Parkinson's disease market attractive for drug companies. So you've seen companies exit the market recently because I think it was Pfizer who said they couldn't do anything profitably. My view of an orphan drug status is it gives you 7 years patent expiry protection, so it's going to make that market attractive again. So that's why we would want to explore orphan drugs. What's the link to what we've been talking about? To actually prove that, you have to show that there's a benefit in a group of patients. And that's absolutely what we're trying to connect with these feedback forms. So if you are a young onset Parkinson's patient, you actually qualify as a rare disease already. But in terms of getting drugs used for an orphan designation, we'd have to prove that there is an unmet medical need within that group. So unless we can prove the unmet medical need, we can't lobby to get a drug through for orphan drug status. So we can't then make it attractive by having a longer patent life and a higher price. So in a nutshell, if I've managed to convince you, the link between what we've just heard and orphan drug is that we're trying to identify what it is that can be unique to the smaller population that we can say is an unmet medical need that would then be met by an orphan drug. And the benefit of that is it becomes an attractive proposition because you can have patent protection and charge more for the drugs. Stunned silence.
I don't quite get that.